The good old fry-up, a great British tradition. But like many foods, too much of it can be bad for you. Now it seems jabs originally used to regulate blood sugar levels for type 2 diabetics and weight loss could also help reduce heart attacks. The two jabs are called Ozempic or Wegovy and contain an active ingredient called semaglutide. So how does semaglutide work?
You're going to inject into the skin of your abdomen.
Well, it's injected once a week and makes patients feel fuller, reducing their appetite and so leading them to eat less. Now the largest trial of the medication has been carried out by British and American researchers and funded by the drug manufacturer Novo Nordisk. Participants were over 45 and overweight or obese, but not diabetic. More than 17,500 patients were involved. Half of them were given semaglutide. After 3 years, they had a 20% lower risk of heart attacks or strokes, regardless of how much weight they lost. And those that did lose weight maintained it for at least 4 years.
These drugs have shifted from being diabetes drugs to obesity drugs and now have the potential to modify important diseases and add to our ability to treat heart disease and other conditions as well. So it is a landmark moment in the way we think about their role in not only managing obesity, but also managing patients' important conditions like heart disease.
The government says obesity costs the NHS around £6.5 billion a year. Now it seems the drugs that are proving so effective in tackling that epidemic could also be life-changing for those at risk of heart disease.
Well, joining me now is Professor Frank Joseph, a weight loss expert who was one of the investigators in the study. The study described it as a game changer because of its impact on potentially reducing heart attacks. Do you concur?
I do, actually, because the fascinating thing about these drugs is that it was developed originally for diabetes. And as the stories evolved, what we found is not only does it help people with type 2 diabetes and reduce their risk of heart attacks and strokes and death, but you then can impact people who don't have diabetes. And the first thing you do, and what we've known about semaglutide or Wegovy, is that it's a great drug to help people lose weight and get healthier. But what this new data suggests is that it goes beyond just the weight loss, and that actually what it does is reduce your risk of heart attacks, strokes, and cardiovascular death if you've had a previous heart attack or stroke.
But it's not been peer-reviewed, this study. It's not appeared in a scientific journal yet, and it was funded by the drug manufacturer. So are people getting a bit overexcited?
I don't think so. I think, we've got to stay optimistic about this stuff because, as a physician, I'm constantly looking for the next thing that I can offer my patients to try and reduce their risk. Because once you've had a heart attack or a stroke, the anxiety of possibly having another one is something that we don't want to live with. And if you can find something that will reduce that further and further, it's absolutely worth thinking about.
And some of your patients in the northwest of England were the patients in this trial. So what did you see?
Yeah, so a lot of the patients that we enrolled had previous heart attacks or strokes and got into the trial. Now, the interesting thing about the study, it wasn't about weight loss. It was about trying to see what the medication would do to modifying their risk of having another event. So what we call non-fatal myocardial infarction, or a heart attack that you don't die from, or a stroke that you don't die from. And what you find is that some people did lose weight, and that's part of the effect of the medication. But in the wider scheme, when you start to look at the larger numbers, you see that people aren't having as many heart attacks and strokes.
And the hype about semaglutide is that it has been found to improve people's weight, right? Yeah. Would you therefore put the 1 in 4 people or the 1 in 3 obese men over 50, whatever it is, on this drug routinely?
So if you are, by definition, living with obesity, so if your BMI is over 30, you're allowed to have it because actually it will reduce your risk of developing conditions in the future. Because we know that the moment your BMI goes over 30, you are at risk of high blood pressure, cholesterol, diabetes, heart disease.
But
so, yeah.
A quarter of the population are obese. You would have them all on this drug.
If you could afford it, then there is no reason why you wouldn't want to try and treat them. Now, that goes with caveats, though.
Can we afford it? I mean, because a lot of people stand to make a lot of money from this, not least the drug company.
And I think the challenge there is, and we have great checks and balances in the NHS for that. You know, you have NICE that will look at the cost effectiveness of these treatments and will tell you what the right amount, right treatment, right person is going to be like. And in terms of treating every person with a BMI over 30, they've got to have tried to have done it themselves to start with. And actually, for a lot of people, diet, exercise, the right support will give you the right answer. But this is for people who've tried and have failed and tried and have failed over and over again.
Have you any concerns about it?
I mean, with any medication that I give people, I'm always cautious about side effects. You know, even with semaglutide and with some of the newer agents like Mounjaro or tirzepatide, we do talk about gastrointestinal side effects, nausea, diarrhea, vomiting, and constipation, and also gallstone formation.
They're all physical side effects. Just one question about mental health impacts. This suppresses people's appetite. Do we know how that would affect people at a population level?
Yeah, so in my personal practice, when people are struggling with their weight, often their mood and their affect is affected by the weight that they're carrying. And sometimes they find that just having a treatment that allows them to get healthier and feel better in themselves actually makes them feel better. Their mood's uplifted. Because a lot of the times for a lot of these people, they're fighting that constant noise in their head saying, you know, I'm giving in to temptation, but actually it's biology that's driving their need, and it helps them to overcome that.
OK, Professor Frank Joseph, we have to leave it there, but thank you so much for speaking with us.